Thank you, Governor, and good afternoon, everyone. Thank you for joining us. Let me run through some of the numbers we typically run through for our public health update. There are now more than 3.2 million cases of COVID-19 globally, including more than 1 million cases in the United States. In New Hampshire, we have tested a total of 24,349 people for COVID-19. And in the last couple of days specifically, we have tested on average about 1,200 people per day. Currently, there are about 159 people undergoing testing within our public health laboratory. We are announcing an additional 164 people who have tested positive for COVID-19. That brings the total in New Hampshire to 2,310. Of these individuals, 270, which is an additional 8 individuals from what we reported yesterday, have required hospitalization at some point in their illness. And unfortunately, there are 9 additional deaths related to COVID-19 that we are reporting today, bringing the total of people who have died from COVID-19 in New Hampshire to 81. All of these new people who have passed away from COVID-19 were associated with long-term care or nursing facilities. I think these numbers point to and reflect the difficulty that New Hampshire and many other states around the country are having in terms of controlling the transmission of COVID-19 once it gains a foothold in our close living and congregate living settings like long-term care and nursing facilities. So as you're going to hear in a little bit, even as we talk and plan about how to reopen different segments of society in the coming weeks, it still remains critically important for us to protect those who are most vulnerable in our communities, and specifically older adults and those with chronic medical conditions, which put them at increased risk of adverse complications from COVID-19, need to still remain at home as much as possible and only go out for the essentials. And we need to do our collective job in terms of helping these individuals, these populations, social distance so that we can protect them. Now, we are looking very closely at the numbers every single day. And as I've said in the past, our epidemic curve, which we publish on our website on a weekly basis, continues to show a plateau or a leveling off in the number of cases when graphed every day. The hospitalizations remain stable, and our healthcare system also remains stable and not close to surge capacity. And you'll see some more information about this in a little bit. While we test more, we are going to identify more cases, which I think is what you are seeing and hearing about the last week. But there are some promising signals in the data. There are early signs that the daily number of new hospitalizations may be starting to slow. The percentage of all of our confirmed cases that have required hospitalization at some point in their illness is slowly decreasing. We're down to below 12% of our confirmed COVID-19 cases have required hospitalization at some point in their illness. And the doubling time, which can be calculated probably most accurately by looking at our hospitalization data, the cumulative total number of hospitalizations, has been slowly prolonging throughout the course of the outbreak in New Hampshire. It used to be very early on in the course of the outbreak, 3 to 4 day doubling time, then it lengthened to 8 to 9 days. Currently, we're up around 4 weeks, or approximately 30 days in terms of a doubling time for COVID-19 based on our hospitalization data. And our deaths. Well, we have unfortunately had to report some higher numbers of deaths in the last week, including today. The number of COVID-19 related deaths in the community has been overall low. In the last 7 or 8 days, there have been a total of 30 people approximately who have died from COVID-19 that we have announced. And all of these individuals, except for one, have been associated with our congregate living settings. And I think this potentially highlights the decreasing transmission within our community, but it still highlights the ongoing work that we have to do to protect those in long-term care and nursing facilities, in congregate living settings, where these outbreaks are really devastating to the facilities, the individuals in the facilities, and the families involved in these unfortunate losses. So I'm going to turn things over to the governor in just a minute. But I want to just summarize by saying that our social distancing efforts have been having an effect. There is some early signals of decreasing community-level transmission, but we still encourage people to stay at home as much as possible, leaving only for essentials. We want people to, when they're out, still keep a safe distance of at least 6 feet from people at all times. Practice good hand hygiene, and when in public places, especially if social distancing may be difficult, please wear at a minimum a cloth face covering to protect others from the possibility of asymptomatic or pre-symptomatic transmission. You will see this guidance incorporated into what is going to be talked about in a little bit around Stay at Home 2.0. I want to thank you all for your perseverance and for doing the hard work of helping to stop the spread of COVID-19. Thank you.